you clicked on this video, then you're here for one thing and one thing only, so let's get right into it. These are the top 10 highest paying doctor specialties in 2026. For those of you guys who are new here, my name is Sean Anderson and I'm a second-year anesthesiology resident based in San Diego, California. I make weekly vlogs about what it's like to be a resident in training, so if that sounds interesting to you, then make sure to subscribe. And for all the salary data, I'll be using Merit, a free salary sharing website built by clinicians for clinicians. Coming in at the number 10 slot is dermatology. Dermatologists are doctors who specialize in the diagnosis and medical or surgical management of diseases of the skin, hair, nails, and mucous membranes. As you can see here on Merit, the average dermatology salary in the United States is $523,000 a year. But if you look at the salary floor and ceiling, you can see that there is a huge range of earning potentials in dermatology. So the top 5th percentile of dermatologists are earning more than $934,000 a year, and the bottom 5th percentile is earning on average $300,000 a year. So even though dermatology is number 10 on our list, they could be number 1 if they decide to grind it out and make closer to the million mark. To become a dermatologist in the United States, you must complete 4 years of medical school followed by 4 years of residency, which consists of 1 prelim year and then 3 years specifically for dermatology. If we scroll down on the dermatology page, you can see a variety of salaries from dermatologists that they have contributed to Merit. But if you look here at the specialty and demographic breakdown, you can see that dermatologists that go on to specialize in micrographic surgery and dermatologic oncology actually can earn $700,000 per year. And that's probably where we're seeing that upper percentile from. So again, there's always more to the picture than just the average salary. Let's move on to number 9 on our list, anesthesiology. Now I'm a little bit biased being an anesthesia resident and all, but I think anesthesiology is one of the best specialties on this list. Anesthesiologists are the pilots of the operating room, and we do everything from anesthesia to amnesia and analgesia. You see us in the ORs, you see us in the trauma bays, you see us on the labor and delivery floor. There's a lot you can do with anesthesia, so again, I'm a big fan. As you can see here on Merit, the average salary for anesthesiologists in the United States is $543,000 per year, with the upper 5th percentile earning about $750,000 per year, and the bottom 5th percentile earning on average $385,000 per year. So just like dermatology, there is a range of earning potentials. To become an anesthesiologist after medical school, you have to complete 4 years of residency, and just like dermatology, that consists of 1 prelim year or intern year, and then 3 years of specialized training in anesthesiology. What's cool about these specialties that require a prelim year is that you can do them in different places. So for example, I was able to do my intern year back home in Las Vegas before moving to San Diego for my anesthesia training. And that was really cool because it let me spend 1 more year with my family and friends before I had to move. But as you'll see later, that's actually the exception, and most specialties are not like that. So let's scroll past the list of salaries that anesthesiologists have submitted and look at the different subspecialties. And you can see that anesthesiology has a lot. There are various amounts of fellowship options that you can take with anesthesia. And you can see that there actually isn't that much variability in earning potential between the different subspecialties. And this is one of the reasons that fellowship application rates in anesthesia have actually dropped over the last 10 years or so, because it doesn't really make a lot of sense to do more training for not more pay. And once you're done with anesthesia residency, you can still work in a lot of these specialties because of our training. Something I want to point out is that OB anesthesiologists make on average $469,000 per year. So imagine doing an entire year of fellowship just to earn like $80,000 less on average. Doesn't make a whole lot of sense. All right, enough about anesthesiology. Let's move on to number 8 on our list, urology. Urologists are doctors who diagnose and treat disorders of the male and female urinary tracts and male reproductive system. The conditions they manage can vary from minor, non-surgical problems like UTIs and benign prostatic hyperplasia to complex issues requiring surgical interventions such as cancers and congenital abnormalities. As you can see here on Merit, the average urologist salary in the United States is about $562,000 per year, with the top 5th percentile earning about $827,000 per year, and the bottom 5th percentile earning on average $373,000 per year. Becoming a urologist in the United States requires on average 5 to 6 years of training after medical school. This consists of 1 to 2 years of general surgery, followed by 3 to 4 years of urology. And that's followed by 1 to 3 years of fellowship if you want to subspecialize further. Let's scroll down to the subspecialties, and you can see that pediatric urologists actually make less on average than general urologists, and urogyn and reconstructive urologists make even less than that. So again, not a lot of incentive to do a lot of postgraduate training for some of these specialties. All right, number 7, and this specialty has a special place in my heart, Cardiology. Cardiologists are physicians who specialize in diseases of the heart and blood vessels, managing complex cardiac conditions such as heart attacks and abnormal heart rhythms. According to the data on Merit, the average cardiologist salary in the United States is about $575,000 per year, with the upper 5th percentile earning on average $908,000 per year, and the bottom 5th percentile earning on average $336,000 a year. I think something we're noticing with the top 10 highest paying specialties is that the earning potentials are very, very broad. But I think that's one of the reasons that these specialties are so enticing, because it really does reward you for your hard work. To become a cardiologist, you must complete 3 years of internal medicine residency, followed by another 3 years of cardiology fellowship. And if you want to subspecialize further in interventional cardiology or electrophysiology, that's another 1 to 2 years of fellowship training. Lots of training, but also lots of money. And speaking of subspecializing, you can see that it actually pays off in cardiology. Interventional cardiologists and electrophysiologists are making much closer to $700,000 per year. So that might be worth the extra training. All right, next up in the number 6 spot is gastroenterology. Gastroenterologists are doctors who specialize in the digestive system, including the stomach, bowels, liver, and gallbladder. They treat everything from abdominal pain and ulcers to cancer and liver failure. They also perform a variety of diagnostic and therapeutic procedures using endoscopes to visualize internal organs. And according to Merit, the average gastroenterologist earns $582,000 per year. The upper 5th percentile is closer to $900,000 per year, and the bottom 5th percentile is $340,000 per year. Now, to become a gastroenterologist, the training is honestly pretty cheeks and pretty similar to cardiology. You must complete 3 years of internal medicine residency, followed by another 3 years of gastroenterology fellowship. But for how much more on average they make than internal medicine physicians, might be worth it for you. All right, let's move on to number 5 on the list. And this specialty has been getting a lot of exposure lately, and so have the patients. Radiation oncology. Radiation oncologists are doctors who specialize in the use of ionizing radiation to treat a variety of benign and malignant diseases. If you hear about a patient needing radiation to treat their cancer, for example, these are the doctors that are doing it. In the United States, radiation oncologists earn on average $601,000 per year, with the top 5th percentile earning $949,000 per year, and the bottom 5th percentile earning $360,000 a year. Those are some hot numbers. To become a radiation oncologist in the United States, you must complete 5 years of residency, which includes 1 prelim year and 4 years of rad onc. Moving on to number 4 on our list, and this specialty is also pretty rad. Radiology. And if you guys have been following along with my vlogs during medical school, then you know my best friend DePaul actually matched into radiology, and he is absolutely loving it. As you can see here on Merit, the average DePaul makes $629,000 per year, with the top 5th percentile earning $999,000 per year on average, and the bottom 5th percentile earning $400,000 a year on average. This means DePaul will definitely be out earning me in my career, which is unfortunate. So I'm gonna really need you guys to smash that like button and subscribe to the channel. We can't let him out earn me. That's just not cool. To become a radiologist, you have to go through 5 years of residency, which includes 1 prelim year and 4 years of radiology. And fun fact, even though DePaul and I matched in different specialties at different programs, we were actually able to do our prelim year together, which was a lot of fun. And as you can see here on Merit, radiology has a lot of subspecialties, and the earning potentials vary a lot. So for example, an interventional radiologist can earn on average $628,000 per year, or a neuroendovascular interventional radiologist can earn on average $700,000 per year. So extra fellowship in radiology might just be worth it. Now let's move on to the big 3. In the number 3 spot, we have the one and only plastic surgery. Plastic surgeons are doctors who deal with the repair, reconstruction, and replacement of physical defects involving various areas of the body. They use cosmetic surgical principles to improve the outcomes and appearance of reconstructive procedures. So not only can they fix you, but they can also make you look pretty, which matters. That really is medical care as well. If you get a giant cut on your face, you're gonna want a plastic surgeon fixing it. The average plastic surgeon in the United States earns $637,000 per year. And now here are where some of these percentiles get crazy. The top 5th percentile earns $1.1 million per year, and the bottom 5th percentile earns $242,000 a year. This is now the widest range we've seen, but this actually makes a lot of sense when you think about the kinds of things that plastic surgeons are dealing with, because they're not only doing reconstructive cases, but they're also doing elective procedures. Once you get into the realm of doing things that insurance may not cover because of medical necessity, your earning potential goes a lot higher. Basically what I'm trying to say is a lot of these patients will pay out of pocket for these procedures rather than going through their insurance. But again, that's for elective cosmetic surgeries. Plastic surgeons are also very involved in very necessary surgeries, for example, burn cases. I think a lot of people don't know that about plastic surgery, especially with TV shows that really just show the cosmetic side of it. But plastic surgeons are very important, especially when it comes to our trauma patients. To become a plastic surgeon, there's actually two different pathways. There's the integrated pathway, which involves 6 years of plastic surgery residency, or the independent pathway that is actually 5 years of general surgery followed by 3 years of plastics. Now, like I said earlier, plastic surgery has a range of earning potentials, so the average plastic surgeon may earn in the $600,000 range, but if you look at the cosmetic and reconstructive plastic surgeons, they're earning way over $800,000 per year on average. And again, that's because of that cosmetic side. But what's interesting is that if you choose to specialize in hand, you actually make a lot less money. As I've already said before, I always find that making less money for more training doesn't make a lot of sense. At least from a financial perspective. If that's what you really want to do, then you totally should. And we actually need everyone in all these different subspecialties. Now moving on to number 2 on our list, and the only specialty that you actually have to bench 2 plates during your interview for: orthopedic surgery. Orthopedic surgery focuses on surgical interventions of the musculoskeletal system. Think things like fractures or broken bones. But they also do surgeries of the tendons, ligaments, joints, and sometimes even nerve or vascular issues. Orthopedic surgeons in the United States make on average $733,000 per year, with the upper 5th percentile earning on average $1.5 million per year, and the bottom 5th percentile earning on average $341,000 per year. That's a lot of money. To become an orthopedic surgeon, you must complete 5 years of orthopedic surgery residency after medical school. And just like plastics, orthopedic surgeons can also subspecialize, and pretty much all of these specialties have really high earning potentials. But what's interesting is that foot and ankle and pediatric orthopedic surgery actually earns much less on average. And without further ado, let's move on to the number 1 spot on this list. And this one is a no-brainer if you're trying to make the big bucks: neurosurgery. Neurosurgery deals with surgical interventions of the central and peripheral nervous systems. Basically, the brain, spinal cord, and all the nerves in your body. Now let's look at the salary. The average neurosurgeon in the United States is making $875,000 a year, with the top 5th percentile earning $1.3 million per year and the bottom 5th percentile earning $514,000 per year. What's interesting about these percentiles is the floor for a lot of the specialties we've looked at is closer to $200,000 to $300,000 per year, but the floor for neurosurgery is about $500,000 per year. But straight up, they deserve it. Neurosurgeons work very hard. In fact, a few months ago, I did a rotation through the neuro ICU. So I worked with all of our neurosurgeons, and let me tell you, they are always working. They're always on call, and the residents, I swear, are always there. I feel like I was not able to complain about my work hours because I would leave, and then when I came back in the morning, they were still there. So not only do they make a lot of money, but they don't have time to spend it, so they save a lot of it as well. Now, neurosurgery is the longest residency you can do after medical school, and it is 7 years of training. And like I've already alluded to, neurosurgery is probably one of the most difficult trainings you can do, not just because it's 7 years long, but also what you're doing in those 7 years, the time spent in the hospital, didactics, everything is far more than any other specialty. I'll always give mad respect for our neurosurgical colleagues. And for the masochists out there, you can even do more training and do a fellowship in spine, which brings your average salary to about $905,000 per year. Again, you gotta love it at that point. Like, I cannot imagine being in training that long, but there are people that do. And we, again, really need them to. And those are the top 10 highest paying doctor specialties of 2026. Now, I want to remind you guys that these are just 10 specialties of the many different specialties you can go into as a physician. And even within those specialties, there is a wide range of earning potentials. So that means that even a family medicine physician can out earn a plastic surgeon, for example. It just depends on you and what kind of work-life balance you want. And that's something I really love about Merit, is you have access to all these salaries that are submitted by actual physicians and clinicians. If you guys have been watching the channel, then you know that we work with Merit a lot. And that's because we really, really love their mission, which is to increase salary transparency in healthcare. Like I said, Merit was created by clinicians for clinicians. So if you're a clinician and want to help increase salary transparency, then I highly recommend you go onto Merit and submit your own data. It's super quick and anonymous, and you get access to all of their resources, including their job search tool, which is pretty cool because you can literally see the contracts right there on Merit and have it compared to actual salaries that have been reported by other clinicians to make sure you're getting a fair contract. You can even express your interest directly through Merit and have the employer reach out to you. That is definitely a tool I will be using when I start to look for my first job as an anesthesiologist, which is not that far away. That'll be kind of towards the tail end of next year, which is pretty crazy to say. Also, a big reminder that if you don't like your day-to-day work, no amount of money will make up for that. At the end of the day, you should choose the specialty you are most passionate about. That's what you're gonna do for the rest of your life. Anyway, that's all I got for now. Thank you guys so much for watching. Make sure to like, comment, subscribe, and I will see you guys next time.